All right, guys, so welcome to Bulletproof Your Low Back. As you know, I'm your chiropractor, and thank you for being here today. So here's the deal. Low back pain, tight muscles, loss of range of motion, stiffness, leg pain, right? So, I mean, low back pain can manifest in many, many, many different ways, right? But what I want to do tonight is I want to give you an understanding of the underlying mechanisms that give us low back pain, all right? I'm a firm believer that if you know more about your body, you're going to take better care of it, right? So we're just going to give you a ton of information, and we're actually going to give you things actually to do about it, right? Sound like a plan? So what I'll do is I'll make sure that I stick around at the end and answer your questions individually and specifically, right? And the big thing about our care in our office is you guys have unlimited access to us. So if there's a question here or something where you go, hey, you know what? I really have not been doing my exercises in full disclosure. Could I have help with those? Or you know what, maybe it's my habits that need the help. Right? I'm doing this thing that's causing my problems, right? Or if you have one of those aha moments of, okay, all right, I'm doing that and that's not helping, make sure you schedule extra time with us, right? Because we want to make an impact in your life. Guys, chiropractors are typically known, as back pain doctors, right? Many of you guys came into the office with back pain, right? But I want you to understand, we're not back pain doctors. We're about function, right? Because back pain's horrible, right? Do you live with back pain or do you live around it, right? And remember, I mean, guys, am I excited about my job, right? I mean, do you think anyone could be really that excited about low back pain, right? You know what I mean? I'm like, so it's all about improving your function, right? It's all about improving the quality of your life, right? So, but let's talk a little bit about low back pain, right? Because that's why you're here. So, what is pain, right? So have you guys, and when we first met, I had to ask you this question, like 10 being the worst pain ever, 0 being no pain, how would you rate your pain, right? But one of the things I want you to understand is physiologically, pain is an emotion, right? Pain is processed by this part of your brain called the limbic system, right? So my wife had a 42-hour unmedicated labor with our first child. So like pain to her is a lot different than pain to me. I stub my toe and I'm like, ah! She's like, you gotta be kidding me. 42 hours, no drugs. I practiced the child the size of a head, the size of a watermelon. You know what I mean? So pain is really individual, right? So if I asked you, hey, what's your pain? Is that like a stupid question or is that a stupid question, right? So, but I want you to understand, is the body smart or is the body stupid? It's smart, right? So I want you to understand that physiologically pain is there for a reason, right? Pain is to tell you, hey, hotshot, don't do that. Hey, lady, stop doing that thing. Hey, buddy, start doing these exercises because you got a degenerative joint and the muscles that support and protect that joint are completely atrophied. Pain is like a baby crying, right? Right? Would you ignore a baby crying? Well, it depends on the baby, right? No, right? But understand that we can't judge your health by pain, right? Pain is really like the tip of the iceberg, right? We all know, right? It's an iceberg, the 3/4 of the iceberg's under the water, right? One of the healthiest patients I have in my practice, works out with a trainer 3 times a week, right? Had a heart attack like last year, right? Was that heart attack, and it's the last person in my practice that I would have ever thought would have had a heart attack, right? But was that heart attack an early sign or a late sign of heart disease? Late sign, right? So tooth pain, is that an early sign or late sign of tooth decay? Right? Diabetes, what are the early signs for that? Cancer, what's the early signs for that, right? So by the time we get pains or symptoms or signs, typically that problem's been there for a while, right? So that's why when we are in our office, we don't judge your progress by, well, how about your pain on the 10 scale? We plug you into the computer. We measure objective measurements, right? We look at thermography. We look at EMG. We look at x-rays. We look at leg length evaluations. We look for quality of life. Are you reaching your health goals? This is what you came in the office for. This is what you said you weren't doing that you wanted to do. And are you doing those now? Yes, good. All right, let's go. Next, right? So here's the thing I want you to understand about pain. So, all right, this is the pain pathway. And what happens is you stub your toe. So the site of injury, we just call that tissue damage, right? So your body has tissue damage, right? And then it's basically conducted by what's called an afferent nerve, fancy word for a nerve that goes up to the brain. tissue damage, nerve, goes to the spinal cord. We're going to talk about the spinal cord actually a lot today, right? And then at the spinal cord, it then goes up to the brain and is processed by this part of the body called the limbic system, right? So let me ask you, if you have pain when you touch a hot stove, is that a good thing or bad thing? It's a good thing, right? So if I could give you a drug that took away the pain when you touched a hot stove, would you take it? Why? Right? Because it just would create further injury, right? An insult. So, what is it? Is it a 6 or a 9, right? So you guys have noticed I look at things a little bit differently, right? Sometimes maybe a little weird, right? But am I crazy or am I sane? Good one, Rose, right? So here's the thing. Have you guys ever heard that, we got like a drug problem in our country? Right? So, so here's the deal. Back pain, it costs us tremendous amounts of money, right? And with all the amount of money we're spending on treating low back pain, wouldn't you think we'd see like a change in it, right? So I don't know, if you keep on doing the same thing and you keep on getting the same result, why would you want to keep on doing that, right? The definition of insanity is different result, right? So here it is. DEA approved drug products. All right, so these are legal narcotics prescribed by a doctor, right? You guys know them as oxycodone, Vicodin, all right, phenylketonuria, morphine, right? More and more and more and more every year. Problem getting better? Nope. Opioid prescriptions per 100 people. The last time I saw this map was actually after a recent election. Just saying, right? But the most drugs, I'm just saying, I'm not saying anything, but I'm just saying, right? But check this out. Okay, opioid prescriptions per 100 people. Wait a second. How can you have 128 to 143, and 107, 120 per 100? That means because people are prescribed more than one opioid, right? Because if one opioid isn't good enough, 2 is definitely better, right? Enough prescription painkillers were prescribed in 2010 to medicate every American adult around the clock for a month. That's a lot of drugs. 40 people die a day, right? So here's the thing with kids, right? So in our office, we see kids, right? Oh, you crazy chiropractor, you're seeing kids. Whoa, why? What? All right, so a lot of times, kids get a sports injury, right? And then they're put on a painkiller, right? And then, hey, by the way, they live in a house that when something goes wrong, the question that we ask is, well, what do I take for that? Not what do I do for that? And then Johnny develops a little opioid issue. And that's happening, right? So, whatever, right? Drugs are drugs. You want to take drugs, feel free. But I want you to understand how they work, right? So here we go. This is how pain is explained. I love this. This was great. I saw this chart and I was like, whoa. My wife, stop throwing stuff, right? Pain pathways and the medications, right? So pain pathways, so here we got tissue damage, okay? The red nerves are the nerves that go into the brain, and the green nerves are the nerves that go back to the body, right? So what happens is you got, again, in review, tissue damage, nerve brings it to the spinal cord brings it to the brain, right? Where are all these sites of action? Green, right? So do pain medications change anything in the tissue? Do they change anything in the brain? Do they change just how you feel the symptom? Right? And here's something really, really, really interesting. If you took all the nerves in your body, right? I want you to think of like a plexus, so like in your house when you the cables that go to your television, right? And you know how there's tiny little wires packed in a common wire, right? And if you were to look at all the little fibers coming out of there, think about 10 of those little fibers, right? Only one of those 10 fibers can perceive or detect pain. What the hell are the other 9 fibers? What are the other 90% of the nerves in your body doing? Like running your body, right? So that's why I say, hey, before your pain is going to change, your muscle tone is going to improve. Your range of motion is going to improve, right? Nerves have different jobs, just like people have different jobs, right? So long story short, 10% of those nerves fail to detect pain. How important are they? Right? 10%, right? How would you like to be 10% important in your body? That's a pretty shitty job, right? I want to be 90% of my body, right? That's a good job. I'm doing a lot of stuff. That's what I'm saying. So, remember, you've all seen my favorite double-headed arrow, right? Half of you could teach this slide better than I can. But for those that are new, we all want to live on this end of the arrow, high-level wellness. On the other end of the arrow, we call that dead, right? Dead sucks, right? So what happens is most of us live, neutral point. I don't have symptoms. I'm okay, right? But sometimes life pushes us back, not age, lifestyle choices, traumas, stresses. At some point, we show up with a sign. What's a sign? Right? It's what precludes a symptom, right? It's the body. You may be able to see it, but you don't feel it, right? The body has body signals. I mean, we call our workshop series the Body Signal Series. I mean, do you think that's just a cute name? I mean, it is a cute name that we came up with our workshop series, right? But your body is giving you messages. It's going to whisper to you through a sign. And if you ignore it, it's going to turn into a symptom, right? And then if you ignore that, it's going to turn into something called a disability. You're stuck with it, right? So here we go again, right? If you're taking a medication, right, is that going to change your position on the number line at all? What changes your position on the number line? Lifestyle choices, decisions, right? Remember, the beliefs you have, right, determine what your behaviors are. Your behaviors or your choices really determine your outcomes or your results, right? So if you believe that, hey, you know what, I got back pain and I got to use the acetaminophen and that's going to help it, right? Remember, pain's there for a reason. It's tell you to, hey, stop doing that joint. Leave it alone, right? So again, we want to move you on the continuum, right? Not just take away your symptom. So here's an owner's manual. But actually, a lot of you guys have very specific what we call congenital anomalies, right? Your spines are built a little bit differently. The stairs are way better. Don't you ever see the inside of that elevator? I see you, right? So a lot of you guys are built a little bit differently, and we can talk a little bit more about that when we get going, all right? But you have this thing called the spine, right? The spine has 3 curves in it. It should have a curve in the neck, should have a curve in between the shoulders, and there should be a curve in the lower back. These 3 curves are absolutely everything, right? Those 3 curves function like one big spring. Between the vertebra are these things called discs. Discs are commonly thought of as bushings, or pardon me, as shock absorbers, but they're really not good at doing that at all, right? What they are bushings or spacers for the delicate nerve system that exits right here, okay? So when we look at your spine from the back, it should be straight and strong, right? So I tell the kids straight is strong. If you took a straw and you put a kink in it, what would happen if you put pressure? It would fold, right? But with no kink, the spine is strong. When you look at it from the side, you need those curves. And that is the primary protective mechanism of this beautiful system we call your spine. A lot of times we talk about disc issues, right? What's a disc? What is a disc? Okay? So a disc, all right, is a bushing or a spacer. Have you guys, I know nobody in this room has ever seen a jelly donut, right? No. Did you believe they put jelly in donuts? I swear to you, it happens, right? So your disc is like a bushing or a spacer, okay? And basically, it's a jelly donut. There's a center of the disc, which is like the jelly, okay? Or think of it as a marble, all right? And then there's these annular layers. Rose, number 1, best patient ever, thank you, right? Thank you. Right? And basically, those annular layers, they wrap around the center of the disc, and they keep the jelly contained, right? Do you guys know what a hernia is, right? It's basically your intestines pop up, right? Hernia, that's basically a fancy name for a tissue is squished or pushed into a space that it doesn't belong in, right? So what happens is through stress, through traumas, through habits, right? Stress, traumas, habits, we call that life, right? Through life, the center of that disc, right, will pop out through these annular layers and then that will put pressure around the nerve system, right? So when people say you have a pinched nerve, right, it's not really pinched, right? When this material gets in a space that it's not supposed to, creates a chemical change, and that inflames and irritates the nerve, right? So you find out about a disc health through an MRI, but through an X-ray you can tell a lot about the health of a disc. So here's a nice healthy X-ray. See how it has a nice healthy curve, right? The bones are smooth and the discs are plump, right? Here's an X-ray that's abnormal. Here is an MRI, okay? So see how the disc here has now put pressure on the nerve system, right? So when someone says, I got the sciatica, right? What is sciatica? It's a disc injury that puts pressure or inflammation on the sciatic nerve. The sciatic nerve is huge, right? It's at least the size of your pinky, right? It's big, right? And once that happens, you're going to get pain that goes all the way down into the leg, right? Is it a leg problem? No. It's a disc problem, right? Most of the time, when people have a disc problem, it's because the foundation that spine sits on is not balanced, right? If the foundation of your house shifted, would you see cracks in the wall? Would the doors not really fit well in the jambs? Anything wrong with the door? No, not really, right? So here is your pelvis. Your pelvis is fantastic. Funny story. So my wife and I, we took birth classes, right? And in birth classes, they have all these models of the pelvis, right? And in our particular class, they had like a pillow pelvis, right? And you want to see a weirdo, be like, oh, where did you get that pillow? He's a chiropractor, he's not a weirdo, right? So anyways, I digress, right? So what we're looking at here is on the bottom, a pelvis from the back and a pelvis from the front, right? Your pelvis is actually made out of 3 separate bones, right? You got your tailbone, right? Nice job, you got a lot of guys are standing right on. You must have a chiropractor that just nags the heck out of you not to sit, right? So you got a sacrum, tailbone, you got your right ilium or hip, you got your left ilium or hip. These 3 bones are actually held together by this really, really thick, really, really important, very, very, very sophisticated ligament system, right? I want you to think like ligaments like the waistband on your favorite pair of sweatpants, right? We all got a pair of sweatpants that like should have died a long time ago, right? What happens to those sweatpants over time? They stretch out, right? Right? So how do they stretch out? Life happens, right? Children, right? Childbirth, sitting all day. All of those things will stretch, right? Habits, traumas, life will stretch those ligaments and allow that pelvis to shift, right? Guys, is your body important? I mean, your brain important? Yeah, right? How do we know? It's entirely encased in a vault of bone, right? Are babies important? Yeah, nature puts it in a vault of bone, right? So when you look at the pelvis from the bird's eye view, right? This is where life happens. Nature is smart. It says, hey, let's protect the species and let's put it in a really, really important place. But it's also pretty smart because little guy's got to get out, right? So what happens is we see a lot of patients that are pregnant, right? I think all pregnant patients, if you're having a baby, you should be under care because you want to make sure that this pelvis can accommodate that child so the baby can form a nice, what we call head down or vertex position, and childbirth can happen the way that it's supposed to. So what we do is when you're pregnant, do your ligaments loosen? Yeah, right? So what happens is if the pelvis is unbalanced, right, it's going to, one, prevent the baby from achieving that optimal birth position, right? And a lot of times you don't have the birth vaginally, right? You have to get a C-section. But what happens after you have a baby? Does the pelvis just go back to normal? Nope, right? So that's why chiropractors, I always see lots of patients, especially after they've had children, right? Usually around 3 years after, right? Because that's when the pain starts to settle in. But what if we just checked the pelvis and made sure that it was really going through the process optimally, right? I'm stuck in the office. I can't tell people that as well as you guys can. So can you help me with that? Thank you, right? All right, so you guys understand your pelvis, you understand your back, you understand your discs, you understand your nerve system a little bit better? Let's give you some things that you can actually go out and do, all right? So, all right, we're in New England. Clarify. Green means go. Red means stop. Yellow does mean slow down, not speed up. Right? Same joke every time, gets better every time, right? So, all right, so let's talk about how you are going to get rid of pain, right? So, there's these special nerves called nociceptors. Anyone know what a nociceptor is? Nobody knows what a nociceptor. You shouldn't, because if you did, whatever. Anyways, a nociceptor is a specific nerve, right, that detects tissue injury, right? It's pain before it gets to the brain. So you got these special nerves, right? These are like the 10%, right? Nociceptors, right? Your body detects tissue damage, right? And then where does it go? The spinal ends with spinal cord, right? There's this other set of nerves called an inhibitory. I'm going to make this interesting. Dare me, right? There's this other set of nerves called an inhibitory neuron. And what those nerves do, they're actually, what fires those off are things like movement, right? When you guys stub your toe or your finger, what's the first thing you do? Anyone ever tell you to do that? Is the body smart or stupid? Smart. Absolutely smart. So movement, temperature, tickle will fire this special inhibitory nerve, and it's going to prevent the spinal cord from sending that signal up to the brain. So long story short, movement, temperature, tickle, adjustments will decrease the volume of the pain signal going to the brain, right? So that's how this works. So, all right, so we're going to take a hammer to your finger, right? Hammer to your finger. You go, ow, I just got a hammer on my finger, right? This special, what's called mechanical receptor, where do they live? Most of them actually live in the top of your neck, SI joints in your feet, right? They're going to race to the spinal cord, turn down the volume on the pain nerve. You're going to have less pain, right? Is movement important for tissue healing? Yeah, right? So in other words, movement is critical, right? Because one, the neurology is actually going to decrease the signal to the brain, unlike medications, which don't really impact anything up into the brain. It's also going to promote tissue healing, right? The longer a joint is immobilized, the more likely it is to break down. Wait a second, Doc, I thought arthritis was from people that have joints that they get too much stress and strain and then they break down. Well, that's true too, that's true. But a joint's going to break down equally as fast if it doesn't move, right? The capsular pressure in the joint increases, damages the synovial lining, and then boom, you get arthritis, both with too much or too little motion in the joint. So, you guys ever hear me talk about this thing called subluxation, right? So it's a joint misalignment from life, from habits, from trauma, right? It creates, just like a sprained ankle, if you sprain an ankle, it creates inflammation and swelling of the soft tissues, which will then cause inflammation around the nerve system, which will cause muscle spasms and pain, right? So again, time out. Are the muscle spasms a good thing? Right? I know they don't feel good, but are the muscle spasms a good thing? What do muscles do? Andrea, what do muscles do? They move bones, right? Muscles move bones, right? Right? The primary job of a muscle is to move a bone. If that joint's not working properly, then the muscle goes to its secondary job, which is stabilizing, splinting, and making, hey, don't do that. That hurt. That's bad for my joint, right? So when you feel a tight muscle, that muscle is intelligent, right? So what do? We massage it? We inject it? No, we let the body be smart, let the body be intelligent, right? In other words, maybe there's some things we got to do to strengthen that muscle so that they can prevent that joint from being damaged. Or maybe there's a habit that we can prevent that joint from being damaged, right? Pain. Pain's there for a reason. Lost imbibition. What is that? All right, imbibition is an awesome word. It's a funny word. Say it 3 times fast, I dare you, right? But you guys, I want you to vision a sponge that's been worked underneath the sink and a sponge that's been sitting on the counter for like a day, right? Mike, what does the sponge look like that's been sitting on the counter for like a day? What does that look like? Shrivel, right? Is it movable or is it like it's crusty, right? Right? And then what is Jackie, we talk dishes all the time. What does that sponge look like that's been worked under the water? Oh, that's the best sponge ever, right? So imbibition is the process of which your disc gets its nutrients in and its waste out, all right? Imbibition is the process of your joints moving through their full healthy range of motion, allowing nutrients to get in and out, all right? So what happens if the joint's not moving? It's like putting the sponge on the counter for like a day and a half, right? Hey, once that sponge dries out, it's always dried out, right? You just can't get it back, right? Wrong, right? What do? You put that dry, crusty sponge under the water and you work that thing. That sponge is good as new. Same thing happens with your body, right? You guys know that your body, your discs lose their blood supply in their early 20s? Your disc has a nutrient supply in the early 20s, you lose it. So that's why from like 25 on, you need healthy movement of the joints in order to maintain healthy discs, right? Guys, you guys have been to most of you have been to my workshops, right? So we talk about how when the body detects a stress, it goes into what? Stress response, right? And stress response is basically increased heart rate, blood pressure, right? It's like your body in fight or flight mode, right? Basically, when your joints go into fixation, it's going to elevate your stress hormones, and that's going to put you into stress response. So that's why people under care that have been under wellness or corrective care have lower incidences, their blood pressure gets lower, their cholesterol improves, right? There's no magic switch on that spine, oh, give me the blood pressure thing. Oh, give me the, I need less cholesterol medication. But we see that all the time. Oh, I want the one for the better immune system. It doesn't work that way, guys. What we do in chiropractic, we allow that nerve system to function properly so your body works the way that it should, which is healthy, right? So you have a fixation in a joint, that's how that creates global or systemic changes in your physiology, right? Think of your spine like a fuse box for your body. Remember, all the nerves go to different structures, right? So very, very important. Again, to beat a dead horse, increased blood pressure, heart rate, muscle tone. We call that heart disease, right? Your spine has something to do with this global physiology, right? Increased blood sugar, cholesterol, right? All of those things in the short term are good, but in the long term are bad, right? Decreased immune system, decreased digestion, decreased sex hormones. We call that marriage, right? No, just joking, right? So how do we fix this spine? For us, this is really important. It's a three-legged stool, right? So it's not like, hey, just come to the office, I'll get you adjusted, and it's all going to be okay, right? I've never said that to anyone, right? You've got to get your adjustments in rhythm, but it can't just be when you're in pain, because that's not going to change the function of the joint at all. The second leg is you got to break your bad habits, right? So, right, if you're doing something that causes the problem in the first place, and you don't want to change that behavior, I'm just like a janitor kind of cleaning up your mess, right? So that's a big thing. It's tough. It's like, I know you guys come in the office, you pay me good money, right? I can't fix your bad habits. I can adjust your spine the best that I can, but I can't force you to do the things that you need to do to stop causing the problem to begin with. Exercise. I can't make you exercise. I can give you the exercises that you need to do, but I can't make you do those exercises. I've tried. I'm paying rent on that space in the back. Some of you are using it, some of you aren't. Use that space, right? If you see more than 2 people in front of you when you come into the office, you got time to go back there and do those exercises that I've showed you for many of you like at least a dozen times, right? So use those exercises. That's why I built that office the way that I built it, is because I wanted to give you guys the time, the space, the tools to do the things to get the best results. I don't charge you to use it, right? I have it because I care about your results and I want you to get the results you want. So let's talk about 2 and 3 a little bit more, right? So sitting, 101, right? So the things that I want you to do is I do want you to sit on a dynamic surface, right? So when you come in the office, you see those little cushions on the chair. Some of you take, well, not you guys actually, but some people take that dynamic cushion and they put it under their chair and then they put their spine in flexion. It's like eating a candy bar in a dentist's office, I'll tell you that, right? So when you see that person, take that phone and throw it. Don't do that. Throw it gently, right? But one of the thing that we all need to stop doing immediately is we need to stop sitting, right? Because that one takes those healthy springs out of the spine. And make it even worse, sit with the spine in forward flexion. That's just not good, right? And just like you wouldn't want to put caramel in between your teeth before you saw the dentist because it would make that harder for the dentist to do their job, you don't want to do that in the office either, because when you put your spine in flexion, that's going to increase your muscle tone. So it makes it harder to adjust you. So sit on that dynamic surface, right? Take care of a couple chiropractors. We had a chiropractor in the office that was getting adjusted, and she was sitting on the dynamic disc. Dr. Brooke, she was rocking it. She was like, and like one of the patients was like, "What was the lady doing to that disc?" Like, she wasn't doing nothing. She was using it the way it was supposed to. So use that thing. If you don't know how to use it, talk to Casey, talk to CJ. We'll teach you how to use it, right? So use a sit-to-stand desk, okay? So I'm not saying you got to stand all day. I'm not telling you, definitely telling you don't need to sit all day. But research shows they really should be changing your position optimally every 15 minutes. Keep the neck out of flexion. Set a desktop timer, right? So when I do a workshop, right, you can imagine each workshop's at least 12 hours of research and development. I set a timer on my phone or on my watch every 15 minutes. I'm going to get up and reset my posture, right? Sit with the bump on the knee above the bump on the hip. All right, so everyone, feel your bump on your hip or your neighbors. It's more fun if you feel your neighbors, especially if you don't know them, right? Come on. Stop touching people back there. No. All right, so you got a bump on your hip. You got a bump on your knee, right? The bump on the knee should be below the bump on the hip. If the bump on the knee is below the bump on the hip, you're going to have a nice, healthy lower back curve, and it's going to function like a spring, right? Sitting with your legs crossed, right? Don't sit with your legs crossed. What's that going to do to the ligaments, right? Not good. It's going to stretch them, just like the sweatpants. Men, Mike, you sitting on a wallet? Are you sitting on a wallet? Nice. Is anyone sitting on a wallet? Mike, you sitting on a wallet? No, you're standing, right? So, all right, you ever seen that George Costanza, the Simpsons, or the Seinfeld episode with like the wallet comes out and it's like that thick, right? Here's an obvious one. You wouldn't stand on a wallet like that was an inch high all day, because that would be bad, right? But why would you sit on it? There's actually a CPT or a medical diagnosis called wallet sciatica. Yeah, it's a fancy word for some schmuck that gave himself sciatica from sitting on too big of a wallet. Stop sitting on your wallet. Put it in the front. Stretching. All right, so here's the big deal. You ever find something that's completely overrated? That's stretching. So is stretching a good thing? Yeah. But I have patients coming all the time. Oh, I got this thing or that thing, but I stretched it out. So that didn't help, but I stretched it out, right? So what I want you to understand, this is well researched, right? It's basically like what I'm calling static stretch. Like you've seen this, like, yep, all right? So static stretching has really been known for a very long time to actually decrease the maximal force that a muscle fiber can generate. Say that again. When you stretch a muscle, it reduces the force that that muscle can transmit, right? And muscles do what? Muscles hold your adjustments. They help your adjustments last longer, right? So if you had that elastic waistband that was stretched out, would you stretch it more? No, but it feels better in the moment because that is stimulating that inhibitory neuron. I told you I'd make neurology interesting, right? So just like when you fire off, we call that the mother's touch. Right? We got a boo-boo. Oh, honey, oh. Right? I do that all the men in the practice. Oh, it's okay. No, right? Because, anyways. So, stretching completely overrated. Right? Yoga, on the other hand, is not overrated. Yoga is awesome. What's the difference between yoga and stretching? It's because when you do yoga, you're incorporating the entire body. You're incorporating the nerve system. Right? So I just went to this big soft tissue seminar over the weekend. And the way that stretching actually works is, like, in order to, like, literally mechanically deform an IT band, right, the connective tissue on the side of your thigh, it takes 2,000 pounds of pressure to do that. Like when they stick an IT band in between a vise and they pull, 2,000 pounds for it to actually stretch. I know sometimes it feels like I'm using 2,000 pounds when I'm stretching you, but right? But what's happening when we're stretching, we're not actually changing the tissue. we're changing the afferent neurology or the nerve impulses into the brain, and the brain is making changes in things called Golgi tendon organs and muscle spindles, right? In other words, good information in, better information out, right? So when you're doing yoga, you're breathing, right? What are you doing? You're getting your body out of that sympathetic nerve system. You're getting yourself out of that muscle, that fight or flight system, which does what to muscle tone? Increases it. You're breathing, you're visualizing. There's some awesome music maybe, right? You're getting out of that sympathetic nerve system. Your muscle tone is decreasing. You're engaging the nerve system. So that's why yoga works, right? Literally, the only thing I've seen in 11 years of practice that actually makes a difference with someone's flexibility is yoga or Pilates, right? If you're having issues with yoga or Pilates, you just haven't found the right yoga Pilates instructor, right? So we can help you with that. Resistance training, okay? So remember, we're going to talk about two things. We're going to talk about prime movers, and we're going to talk about stabilizers, okay? What's a prime mover? Right? I want you to think of Arnold Schwarzenegger, right? The muscles on the outside are prime movers, okay? Their job is to move your body through space, right? Now, what happens is prime movers are many times, this is a classic for a rotator cuff injury, right? You have the deltoid, the thing that looks like a upside down delta or triangle, right, is a prime mover. But if you have weak deltoids, right, the stabilizer muscles take over the job, right? In other words, right, think of a lineman. Lineman's big, sturdy. His job, her job, is to stop people from attacking the quarterback. Think of the kicker. The kicker's a skinny little dude. His job is not to stop the guys from the quarterback. What would happen if you put the kicker in the position? It's actually kind of funny when it does happen, right? When you have a kicker try to tackle, like a punt return guy, not good, right? Because the punter is not built to tackle and defend the quarterback. They're just not built for it. So you need to build your prime movers, right? So you got to do some resistance training, right? So when you do resistance training, right, when you do 1, 2, 3, 4, we call these reps, okay? You've got to do reps in a different variety, right? Because if you had someone that we actually did this in undergraduate at Ithaca, right? You got one person that's training for tone, right? Cut muscle, defined muscle. You got another person that's training for muscle mass, heavy weights, but low number of repetitions. You let them do this for about 6 to 8 weeks, then you get to stab them with a needle called a needle biopsy, right? And then you take that, it was awesome, right? And then you take, you take that muscle and you look under a microscope, and this muscle look completely different under the microscope. This person is like a marathon runner. This person's, right, like a football player. Your body adapts to the stimuluses that you give it. So that's why you don't want big or small. You don't want muscle that's one way or the other. You want functional muscle. So that's why I say every 6 weeks, change your repetition ranges, right? You don't even have to change the exercises that you're doing, although I recommend it, right? But if you do 6 weeks of 12 to 15, and then 10 to 12, and then 8 to 10, right? 6 plus 6 plus 6, that's like what? That's over 3 months, right? So that's good. So keep changing your ranges. Start here though, because that's going to impact the tendons and the ligaments and the soft tissues, right? And if you're going to have an injury, where is it going to be? Soft tissues. It's not going to be the muscles. Muscles are tough. They get tremendous blood supply. They got these things called satellite cells that help them heal when they are injured. Your ligaments and your tendons, not so much, right? So you got to beef these up before you beef up the muscle. Strong prime movers make for healthy joints because they allow the stabilizers to do what stabilizers do. Stabilize, right? So other cool gross anatomy story, right? So you're cutting people apart, right? And you're looking at the prime movers, and these things are big. Right, the prime movers of your back come in 3 layers, like thump, oh cool, thump, and then finally you get to the little tiny stabilizers. These little buggers are so small, they can't move anything. In fact, if you look at a difference between a prime mover and a stabilizer, there's a tremendous amount of nerves compared to the number of motor fibers. All right, so let me use these 10 markers that Casey brought up. Right, it's called a nerve to muscle ratio. Right, a prime mover has only a few nerves for a lot of muscle fibers. A stabilizer has tons of nerve relative to the number of muscle fibers that it controls. So your stabilizers are more, you guys know what a force transducer is? Right? Tells the joint where it is in space. Your stabilizers are more like nerves than they are like muscles. Right? Last thing. You guys ever notice that when I check your spine, a lot of times you're on the table and I say, hey, look right and hey, look left. And by the way, 50% of you get your left and your right wrong. It's actually, that's awesome, right? Every time, right? So anyway, right? So when you look right and you look left, that impacts your leg lengths sometimes, right? For those of you that go, hey, I'm going to find like a bruise-like thing at the top of the neck I didn't put there, try to fix it, same joke, every patient, every time, right? That's what we call cervical syndrome, right? I want you to understand how this works. When you sleep, don't sleep on your stomach, because you got to do this whole breathing thing, right? And what happens is when you breathe, you end up rotating your cervical spine, and you create ligament laxity, right? And it creates asymmetries, all right? Feel, you know the little bumpy things you have on your back, all right? If you can't feel yours, feel your neighbors. Again, it's better if you don't know them, right? But these little bumpy things are the spinous processes, all right? So we're looking at your spine from the back, all right? And what happens is if you sleep on your stomach, right, and you got to breathe, you're looking to the left, right? What happens is when I say, hey, look to the left. Well, you're already malpositioned that way, so that's easy. But when I say, hey, look to the right, you come to neurological neutral, and your legs magically come to the same distance, same length. Is there anything wrong with your leg length? No, because I check it with the tape measure, right? It's all rotation within your spine, right? Imagine a string. Right? If you had a string and you wanted to bring it up, you would do what? You could twist it at the top, and that would pull it up, right? Your nerve system is the same way. So stop sleeping on your stomach. Same is true if you have this, oh, I love my computer screen over there because I got this beautiful window. Well, stop messing up your spine, right? So you got to be careful about when you're rotating. Oh, I'm trying to get Casey to buy a headset because she's, right, to make my job harder. It's like, get trapped down now, right? Right? So again, be conscious of your habits. Your habits, you ever hear the expression, bend the twig, so grows the tree? Your habits are the thing that bends the twig. All right, address the cause, not the symptoms, right? So remember, pain is there to tell you something's got to change, right? Maybe it's we got to make sure that we're making better changes to that joint. Maybe that changes, you got a habit that needs to be altered. Maybe that changes, you got to do more exercises so you can hold your adjustments better. But your body's smart, it's intelligent, it's telling you something. Movement is life, right? Know your wiring, right? So the next time you go, hey, you know what? I want to take that, it hurts, right? Try movement, walking, swimming, right? Low impact, elliptical, those types of things. Sit less, move more, do yoga, do Pilates. Resistance train, you got to core train, you got to resistance train, and it's not a bad idea to use that cardiovascular system. I mean, that's the thing that kind of fuels the whole thing, all right? Sleep tight tonight, but not on your stomach, all right? So guys, thank you so much. I want to just thank and appreciate you all for being here. And remember, if you have questions, follow-up questions on this, just let me know, right? We'll schedule some time, right? We'll make sure that you get what you need to get out of this process, right? But remember, you get out of this what you put into it, right? So done with you, not for you though. All right, guys, have a great night.